So the first question is, what does your company do? And more importantly, why does it impact and change and improve health equity? What are you doing in the health equity realm?
I'm Tobias, and I'm running a company called Huma Group, and we are a global health tech company. Um, the programs we are running here are in UK based mostly. The NHS has been at the forefront of health equity, and partly because of this single payer system, we know very well that we know a lot about how different groups in society benefit from different services and uptake. And our challenge and what we have filed here for this particular award is around cervical screening. People in England are due for screening that happens between the 25 years old and 64. And the program itself is credited to save about 5,000 lives a year. We've had challenges in London, for example. We have 65% uptake of this potentially life-saving service. And so our challenge throughout has been, how do we solve the health equity gap? How do we get underrepresented groups to engage with this program? It's behavioral, educational, socioeconomic factors, English not as first language, complicated. All of that plays into different groups in society. Effectively, some are diagnosed early and some are not. Some live and some don't. And so it is the massive scale. Our intervention in east of England saved 29,000 screens in one single year, and their life saved as a result of that. And the beauty of our intervention was that actually the absence of variations between social groups.
I want to know a real example from each of you of where what you did moved the needle with one of those with an underserved group, and they were at some point before and they were at some point after that made a difference because of what you guys and what your organization, your companies and products did.
Yeah, I got carried away there. I don't want to repeat myself, but I think what we do see and what this is all about, at least for me, is this view of the pre-symptomatic diagnosis of disease. And we see, in terms of outcomes, we see people pretty much, not weekly perhaps, but stories about people who are screened and a cancer caught early, and then leading to potentially a saved life. And of course, that is the miracle here we're trying to achieve. And where equity comes in, it's just people, different groups of society are underrepresented when it comes up with the services. So it is a direct challenge here. And actually, coming back to the evidence we're looking at, it would be ideal if all groups of society, rich, poor, well-educated, not so well-educated, language barriers, cultural barriers, have all took up services, screening services in this nature. And that's exactly what we've achieved through our engagement method.
And I want to raise the ugly point that you may have noticed there's an election coming up, and you may also have noticed that currently in the current administration, the health equity, diversity, inclusion, all that good stuff is actually right there in CMS policy. It may not be, depending on who wins coming up in November in the US. So I don't know who wants to go with this, but what do you think that's going to mean for your work? Does anybody think that that's going to change anything? Are you going to have to double down on stuff? Are you going to have to change the way you behave? I want to get some things about where do we think health equity is going to be as a principle, in January, particularly if one side rather than the other wins.
Of course, everybody have their own personal opinion, and so do I, preference and so on. But I just don't feel that there is a huge difference here. I think that preventative care, as far as we're concerned, is on the up. partly because it's been so underinvested in globally for so long or forever. So it can only get better.